Is what is vaginal tightening and how it is done. Vaginal tightening is the tightening of vaginal canal, uh, which can be done surgically and non-surgically, both ways. Uh, what is the difference? What is vaginal tightening? Vaginal tightening is the surgical or non-surgical way to tighten up the lax or loose vaginal canal. Question arises that how vaginal canal leads to that stage of laxity and getting so loose that you have to tighten it up. Number one cause of vaginal laxity is childbirth. When you give birth to a child, uh, if it is a normal delivery or if it was a forceps delivery or vacuum delivery, or if the head of the baby was big, if the labor was too long, and if you had to go through a prolonged labor for giving birth. And in the end, at times, we have to give a big episiotomy to bring the baby out of the womb or out of the vaginal canal. So, number one cause of the vaginal laxity is childbirth, and the more and more looseness and laxity is seen if there is a history of obstructed labor, shoulder dystocia, vacuum delivery, forceps delivery, a big episiotomy, or a big sized baby, a baby whose weight was more than 7 pounds or 8 pounds or 9 pounds. So all this leads to uh, a lax and loose vagina. Number two, vaginal laxity is also associated with women who tend to have gained a lot of weight, because the more weight you have on this, your abdominal area or on your love handles and in all the this pelvic area, it is going to affect the elasticity and the integrity of the wall in the vagina. Vaginal laxity is very common in women who don't exercise. In my own practice of gynae and my practice here as an esthetician and cosmetic gynecologist, I have seen that a lot of women are suffering from vaginal laxity because they don't understand the dynamics, that how important is the role of exercise, how important is the role of a pelvic diaphragm exercise, and how important is the role of their weight control in keeping their reproductive and pelvic organs in a good shape and good integrity. So today, the topic of this video is that if your vagina is loose, or your husband or your partner or your boyfriend or your spouse is not happy with the current situation of your vagina after 2 or 3 deliveries, or you personally feel yourself that your vagina is like very open, very lax, and it's very old, the look has changed, the look of the labias has changed. So what are the aesthetic solutions in this era we have? The good news is this, that the women of this age, like um, they have like multiple options now. They have a lot of options for their vaginal tightening, for labial repair, for the look of the whole area under legs area is like so dark, so dull, rough skin, black heads, white heads, ingrown hair, and the women are like very underconfident when they come to me. They are like, I feel like a part of their personality has been badly damaged by this particular notion of suffering from vaginal area and its problems. The problem of laxity is one, the problem of labial shrinking and wrinkles and roughened surface, blackening of that area looks very dull, that area looks very aged to the people who are looking at them. She herself doesn't like that. So as a part of the whole conversation, when I talk to them, it is not one issue. It is not a single-handed issue. Okay, fine, I have a loose vagina. This is the whole prospect is that this area has become so much damaged, so much affected by the childbirth and its after effects and my weight gain, that I'm unable to cope up with the look of that. So when I'm talking about vaginal tightness, the good news is this, that now we have all the solutions for the wrinkled labias, for the aged look of the vagina, the aged look of the labias, the whole private area can glow. And you are living in an era when you have a whole list of procedures for you. So this was not the opportunity for women in the previous centuries, and even our mothers, they don't have that privilege, and these procedures are now very cost friendly, very economical, very budget friendly, and they are giving very good results to women. So I see women coming to me in a very fade, sad, and very deeming light. And with time, when they're taking on the sessions, I see them glowing up, having their confidence back, wearing on makeup, feeling good about themselves, feeling totally confident, thriving to their best potential. And this is the best part of my job, which I really like when I transform women. And I'm blessed, and I'm really grateful to my creator that he gave me this job of transformation of the souls from darkness to light. And I think some people find it very funny that how vaginal repair, or the look of vaginal area, or look of breast, or the look of your stretch marks going away from your body, or you losing weight, or your body looking nice, can shift you from a very sad, depressed, and pessimistic person to a very shiny, glowy, and very nice, and very vitalized soul, a person who was not able to talk properly, and the person who used to take Xanax, or Alp, or God forbid, so many medicines for their depression. That person has totally changed to a new person who is wearing clothes, who is wearing nice makeup, who is listening songs, who is a beautiful person who wants to go out, have fun with their kids and husbands, and the people around them are astonished. But as a matter of fact, every woman knows who has been a mother, every woman knows who has been through there during labor, during childbirth, that what kind of a trauma a woman goes through to give birth to a child, and the child is still the most beautiful thing she can ever have. Whenever a mother looks at her child, she feels every bit of pain was worth it. But at the same time, the post delivery complications and the post delivery trauma, which is called PTSD after delivering a baby, it includes all the physical complications you had encountered after the delivery. So it includes you losing your hair, it includes you having a dark body full of stretch marks, you losing your breast, you losing your vitality, your skin glow. And once we give women the tight vagina, the tight breast, the glowing skin, good hair, and everything is back on track, she is the woman whom and everybody wants to have some time with, including their husband and their kids. And that is the best part, I think, aesthetics has offered us today. And the women of today, they must nurture themselves, they must take advantage of this new modern technologies, which are designed to uh, target the aging areas and give you uh, all the relief from the trauma which your tissue had during childbirth. Plus, how we do it, uh, mm, although there are surgical ways to tighten up the vagina, but for that you have to admit in a hospital, you have to opt for 3 to 4 hours surgery, and then you have to stay in the hospital for 2 days. But in aesthetic clinics, under the supervision of a gynecologist and a cosmetic gynecologist, what we do is this: we are offering a series of lasers, ultrasounds, fillers, threads, many DNA therapies, many anti aging rejuvenation therapies which are inserted into the vaginal wall to bring its integrity back, to give you new collagen, morpheus, scarlet, and a lot of other machinery is being used to boost the collagen chunk into the vagina. So women are taking advantage of that, and women are very happy with the results. And I have seen very, very dramatic results in terms of women telling me how their marital life, how the quality of their life has changed at home, how their husband's attention has changed toward them again, how the husband is coming more toward the family, and the focus of family happiness, and everything is back on track, which she was missing previously. The intimacy between the parents of partners, sorry, is highly, highly affected by the post delivery trauma at the body. And I think this is the issue which we all need to address very seriously. And this is the issue which should not be left like a choice. This is the issue which every woman should take, as every wife should take very seriously. Everyone in a relationship should take seriously, um, because it defines the happiness of the relationship for men. And if you satisfy your partner, then there are very, very high chances, not even chances, I can see that people are telling me that they are very happy, and people are very happy with the results and the plans we give them for vaginal tightening. Thank you very much. Leave all your questions in the comment section. Hello. जी वालेकुम सलाम जी बेटा. अभी याद आया मुझे. बिल्कुल बिल्कुल बेटा, वो मैं आपको ना कल करवा दूं सुबह. हाँ बिल्कुल बिल्कुल, कोई मसला नहीं, ठीक है. थैंक यू, टेक केयर. हाँ हाँ, मुझे याद है, सॉरी. ओके, अल्लाह हाफिज. वो हमारी आज वो वीडियो रिकॉर्डिंग चल रही है बहुत ज़्यादा. मैंने बताओ किधर हो अभी. हमारी बन गई ऑलमोस्ट. हाँ. कहाँ. हाँ ठीक है. आओ मैरियट पहुंचो, मैं आ रही हूँ. ओके. अंदर जाओ ना, अंदर बैठ के बात करेंगे. नहीं. अच्छा. मुझे भूख लगी हुई है ना, मैंने सुबह से खाया कुछ नहीं, वीडियोस के चक्कर में आवाज़ नहीं सुन रहा मेरी. मुझे भूख. पता नहीं, कुछ खा लूंगी, कोई कॉफ़ी सैंडविच कुछ हो जाएगा, लेकिन मुझे भूख लगी हुई है. हम्म. वरना. हाँ. तो हम उधर टाई पैन बैठ जाएंगे ना एक साइड पे. कहीं और बैठ जाओ जहाँ वो ना चाहते हो. वो लोग कहाँ फिर रहे हैं. अच्छा. तो किसी ऐसी जगह चले जाओ. यार मैरियट सेफ है वहाँ पे, अंदर कुछ भी नहीं होता. किधर बैठना है. ठहरो भी, टाइम क्या हुआ है, 6 बजे कुछ खुला होता है वहाँ पे. ऐसा करो तुम उधर आ जाओ. मैंने कपड़े भी ऐसे वाहियात पहने हुए ना, बेटा मेरा सो रहा है अंदर. चलो आओ इधर ही आओ, ठीक है। ओके, बैठते हैं इधर ही। मैरियोट ही आ जाओ आप लोग, हाँ। ओके।